Welcome to Unit 1 of Abnormal Psychology, Session number 6, Myths and Misconceptions about Abnormality. Learning objectives. To understand the various myths and misconceptions about abnormality, understanding the stigma attached to abnormality, also becoming aware of the facts and truth about abnormality. Session outcomes. Knowledge of the myths, misconceptions, and stigma related to abnormal behavior. Understanding the true facts about abnormality. Let's start our discussion about the myths and misconceptions about abnormality. Though there is so much of advancement in the field of science and research, there are so many myths and misconceptions that are still very much prevalent and popular among people. Let us try to discuss a few myths and misconceptions that are very much popular among the people even today. Let's start our discussion with the first myth about abnormality. Belief that abnormal behavior is invariably bizarre. There is a picture that is portrayed in the mass media that the abnormal behavior is very much bizarre. They always show the extreme depiction or extreme cases of abnormality, such as sexual assault, murder, and other extreme cases. It is also found that in the media, patients in a mental hospital are shown as rampant raving and ranting. What happens is such a picture is portrayed, it will make the other people also think that all patients all patients with psychological problems will be very much bizarre in their behavior. The actual fact is that very small percentage of people with psychological disturbances are bizarre in their behavior. Not many of them behave in such a way. Next slide. To continue with the same myth, it is also found that normal behavior and abnormal behavior cannot be distinguished completely. Sometimes abnormal behavior may be indistinguishable from the normal behavior. In some instances, abnormal behavior will be self defeating and maladaptive. It is also seen that unusual and extreme cases of abnormality is very rare. Now let's move on to the second myth about abnormality. View that normal and abnormal differ in kind, or they are different in kind. There is a belief that there is a sharp distinction between behavior that is normal and behavior that is abnormal. There is a watertight compartment between normal and abnormal behavior, but that is not true. Any behavior will follow a normal probability curve in which majority of the people will center around the average, and small extreme or small percentage of people fall in the right and the left extreme. Those people in one of the extreme have to receive care in a mental health center, and the people in the other extreme will lead unusually satisfying lives. Next slide. But to continue with the same myth about abnormality, it is also seen that normal and abnormal, they differ in degree but not in kind. Sigmund Freud always said that normal and abnormal, they differ in degree and not in kind. They are not two different types of people. Rather, the degree of adaptability is different. See, adaptive strategies, skills we use, resources we have, problems we face, coping strategies we employ, and the degree of success we achieve are different from one person to another. All these general principles must be applicable to all cases, whether the behavior is usual or unusual. Next, let us move on to the next myth about abnormality. The third myth about abnormality says that former mental patients are unstable and dangerous. Many people who seek help in a mental health hospital will be discharged to their homes later. What happens with these people is society will not treat them appropriately. They're always treated with a sense of suspicion, and they will also have to face a lot of discrimination in the field of job or even housing and even in many other spheres, because society thinks that these people who were once mental patients are very much unstable, and they might be dangerous too. They may harm others also. All these things are a myth about abnormality. There is no research that says that people who are discharged from mental health or hospital are going to be very unstable and dangerous. Next, let us move to the fourth important myth about abnormality. The fourth myth says exaggerated fear of one's own susceptibility to mental health illness or mental illness. Some people feel that they are very much vulnerable, they are very much susceptible or prone to mental health problems. They think that they alone have all the problems, and that is what is the cause of their unhappiness. So, it is very important that we should not be misled by the self confidence or competence of other people. It is always important to realize that many people or majority of the people will have their own problems and will have their own ways of handling the same. Some people may reveal the same and others may not. So, it is important to understand that there is nothing like we are more susceptible and others are not. Okay. Next, let us move on to the next important myth about abnormality, the fifth one. Abnormality or abnormal behavior is something to be ashamed of. Many people feel that whenever they have a mental health issue, they must be ashamed of it because there is a lot of stigma that is attached to mental health issues. Whenever they have a problem, if it is a physical problem, we don't hesitate to consult a physician. But whenever there is a mental health issue, people are very much reluctant to consult a psychologist or a psychiatrist because of the stigma that is attached to that particular behavior. The fact is that there is nothing to be ashamed of. It is always important to seek help whenever there is a mental health issue. Next myth about abnormality is that people with mental health illness or mental illness are weak and lazy. There is a myth that people who are having a mental health issue are those who are weak and they are simply lazy. That is not the fact. The actual fact is that the cause for any mental health issue would be to do with brain chemistry, genetics, and also there could be other problems relating to their psychological environment, maybe an abuse, trauma, etc. So it is wrong to state that such people are weak and lazy. The next myth says that individuals with mental health problems are very much violent. Those individuals who have any psychological issues will be very violent. The fact is that that is not the case. They are not more violent than the people who are normal. And it is also found that they are 10 times more likely to become victims of violence. And there is another research that states that most of the people who are having mental illness are more likely to cause harm to self rather than harming others. Okay, they will not harm others, rather, there might be a possibility of harming self. So, they are not violent, and there is no research that supports that they are very much unpredictable in their behavior and may be very harmful to others. Next myth about abnormality is that taking medication as a course of treatment for any mental illness will alter one's personality. Many people think that when if they take up any medication as a procedure for treating their own mental health problem, it will alter their own personality. But the actual fact is that antidepressants, anti-anxiety medications, antipsychotic medications, etc., that are prescribed by psychiatrists will help these people to reveal their true personality that might be more adaptive and also healthier. So, medication will not alter personality or cause any harm. But in the process of trial and error, there could be some minor side effects. But once they find the right kind of medication, it will be very helpful to the patient, and also to not only just to treat their mental illness, but also to make them develop a better and adaptive personality. The next myth says mental health problems or issues will not trouble me. Some people think that mental health issues will not trouble them, or they alone are spared from all mental health concerns. That is not the fact. Mental health issue is an issue of everybody. Mental health problems can haunt or can be a part of everybody's life. So it is always important to realize that any person may become a victim of mental illness, and it is important to seek treatment and help whenever there is a problem. Now, let us move on to the 10th myth about abnormality. The last myth is that myth or some people think that mental health illness is like any other kind of a medical disease. Many people in the same field and also the pharmacological companies advocate that it is just like a brain disease. Research states that mental health illness is not as simple as a physical illness. The cause of mental illness is very complicated. There is no rather one particular cause cannot be implicated. Rather, it is the interaction of various factors or causes that may result in mental illness. It could be genetics, it could be brain chemistry, abnormalities in the level of neurotransmitters, trauma, psychological factors, socio-cultural factors, and so on. To summarize with this session, we have discussed 10 important myths and misconceptions about abnormality, stigma that is attached to abnormal behavior, and we have also discussed about the true facts about abnormal behavior. Thank you.